Hello everyone, and welcome to this audio podcast. This audio podcast as part of the Labzquad Omega. This audio podcast as part of the Storm Squad. This audio podcast as part of a ZtormLabostix production. In this audio podcast, I'm following on from the audio podcast, looking at coping and what does it mean for healthcare service users. This audio podcast, and as part of this audio podcast series, looking now at particularly around coping and stress in amongst the literature. So, although research has provided valuable insights into how healthcare service users or patients cope with chronic illness or illnesses and the influence of coping on illness adjustment, it remains difficult to determine the applicability of these findings across chronic conditions. It is important to attain sort of better insight into the type of stresses experienced by patients or healthcare service users suffering from different sort of conditions, around different conditions, as information on the nature of disease-related or condition-related stresses may contribute to a better understanding of of healthcare service users or patients' coping strategies. Literature has also explored or investigated different concepts of coping. One review has surmised how young people cope with CKD, and the literature review highlights three central themes within the existing literature on coping: conceptual ambiguity surrounding the definition or the basis of coping, the coping strategies employed by young people, and the barriers that limit understanding of coping processes in this population. There is also evidence to suggest or inform that rates of acute rejection in context of solid organ transplantation are higher when young people have more than one healthcare condition. By implementing healthcare education clinics, for example, the health outcomes and overall quality of life, or QOL, of young people can be improved. Children and young people with CKD and comorbid health conditions who require kidney replacement therapy or KRTs are at risk, can be at increased risk of impaired physical development and challenges with psychosocial integration. The ongoing impact of these health complications into adulthood may adversely affect QOL independence and long-term outcomes. One difficulty in amongst the literature that literature informs one difficulty in relating early coping in young people with chronic illnesses or conditions is that it is challenging to identify and quantify the nature and the intensity of stresses in children and young people or adolescents compared with adults with chronic illness or chronic illnesses due to developmental differences in cognitive appraisal and reporting of stress. Understanding coping in chronic illness populations is important because coping responses may impact disease progression through psychobiological mechanisms, including immune and inflammatory pathways. Animal models of early life stress provide controlled experimental systems that help clarify underlying mechanistics and inform hypotheses for human coping and health research. In the publication by Mohammed and team from 2026, there's some tabulated context or information, some tabulated context in looking at where coping and stress in around the different coping and stress sort of models and theories according to physiology and psychobiological perspectives. So in and part of this audio podcast series, there will be the applicable citation or reference that can be referred to by for listeners and viewers to follow up on this work at their own in their own in on their own way. So that draws this audio podcast to a close. This audio podcast as part of the Labzquad Omega. This audio podcast as part of Storm Squad, and this audio podcast as part of a ZtormLabostix production.